Oxaliplatin Vial is a medication used to treat advanced cancer of the colon and rectum. It is a chemotherapy drug that contains platinum, and it works by slowing or stopping the growth of cancer cells. The dosage and timing of administration will be determined by your doctor based on your specific condition and medical history. It is important to follow your doctor's instructions carefully when taking this medication. Before receiving oxaliplatin, it's important to read the patient information leaflet provided by your healthcare professional. This medication is typically administered through an 4 infusion over a period of at least 2 hours by a healthcare professional. It is usually given every 2 weeks, along with other medications such as 5-fluorouracil and leucovorin. The dosage of oxaliplatin is determined based on your medical condition, body size, and how you respond to the therapy. Some potential side effects of using oxaliplatin vial may include diarrhea, changes in taste, mouth sores, nosebleeds, tiredness, headache, dizziness, trouble sleeping, severe nausea and vomiting, and temporary hair loss. Your doctor may prescribe medication to help with nausea and vomiting. It is recommended to eat several small meals, avoid eating before treatment, or limit activity to help lessen some of these effects. If any of these effects persist or worsen, it is important to notify your doctor or pharmacist promptly. While using this medication, it is possible to experience peripheral neuropathy, which can cause sensitivity to cold, trouble breathing, swallowing or speaking, jaw tightness, strange feeling in the tongue, eye pain, chest pressure, numbness, tingling or pins and needles sensation in the hands, feet, mouth or throat. You may be able to lessen these nerve problems by avoiding cold drinks and ice, and by dressing warmly. If these issues begin to interfere with your normal daily activities, such as walking, writing or eating, it is important to notify your doctor right away. There are also more serious side effects that can occur, such as severe dizziness, fainting, fast or irregular heartbeat, dry cough, shortness of breath, chest pain, black stools, vomit that looks like coffee grounds, vision changes, seizures, sudden confusion, or signs of infection such as a sore throat that doesn't go away, fever, or chills. If you notice any symptoms of a serious allergic reaction, including rash, itching, swelling, severe dizziness, or trouble breathing, seek medical help right away. This is not a complete list of possible side effects, so it is important to contact your doctor or pharmacist if you notice any other effects not listed. Oxaliplatin vial is used to treat colon or rectal cancer that has spread to other parts of the body. It is also used in combination with other medications to treat a certain type of stomach cancer. This medication is given by injection into a vein by a healthcare professional. The dosage is based on your medical condition, body size, and response to treatment. It is important to take precautions while using this medication as it may rarely cause a severe allergic reaction. It is important to get medical help right away if you develop any signs of an allergic reaction such as rash, itching, swelling, trouble breathing, swelling of throat, or dizziness. Always follow the instructions of your healthcare provider and report any concerns or side effects promptly. Before using oxaliplatin, make sure to inform your doctor or pharmacist about any allergies you may have, especially to other platinum-containing products. This medication may contain inactive ingredients that can cause allergic reactions, so it's important to discuss this with your pharmacist. Additionally, it's important to share your medical history with your doctor or pharmacist, especially if you have kidney problems, blood disorders, bone marrow problems, or nerve disorders. Oxaliplatin may affect the heart rhythm, causing serious symptoms that require immediate medical attention. Make sure to inform your doctor if you have certain heart problems, a family history of heart problems, or low levels of potassium or magnesium in your blood. This medication can also cause dizziness or vision changes, and it's important to avoid alcohol or marijuana, as they can increase these effects. Be cautious when driving or using machinery, and limit alcoholic beverages. Before receiving any immunizations or vaccines, inform your healthcare professional that you are using oxaliplatin. It's also important to tell your doctor or dentist about all the products you use before having surgery. Use caution with sharp objects and avoid contact sports to lower your risk of injury while using this medication. Older adults may be more sensitive to certain side effects, and it can also affect fertility in both males and females. If you are pregnant or planning to become pregnant, talk to your doctor about the risks and benefits of using oxaliplatin. Both men and women should ask about reliable forms of birth control during and after treatment. It is not recommended to breastfeed while using this medication, so consult your doctor if you have any concerns. It's important to be aware of potential drug interactions with Oxaliplatin Vial, as they may change how your medications work or increase your risk for serious side effects. Make sure to keep a list of all the products you use and share it with your doctor and pharmacist. Some products that may interact with this drug include aminoglycosides, such as gentamicin, amikacin, amphotericin B, nonsteroidal anti-inflammatory drugs, such as ibuprofen and tacrolimus. Always consult with your doctor before starting, stopping, or changing the dosage of any medicines. If someone has taken too much oxaliplatin and is experiencing severe symptoms like passing out or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call your local poison control center at 1-800-222-1222. In Canada, residents can call a provincial poison control center. Symptoms of an overdose may include severe vomiting, chest pain, shortness of breath, wheezing, very slow heartbeat, and numbness or tingling in the arms or legs. If you or someone you know is experiencing these symptoms, do not hesitate to seek medical assistance. It is important to have regular lab and medical tests while using Oxaliplatin Vial, such as complete blood counts and liver/kidney function tests. Make sure to keep all your medical and lab appointments and consult your doctor for more information. This medication should be taken as directed by your doctor, and the dosage may vary depending on your medical condition. It is usually given by injection into a vein as directed by a healthcare professional. The timing for taking this medication is determined by your doctor based on your specific condition. Make sure to take each dose of Oxaliplatin Vial as prescribed by your doctor. If you happen to miss a dose, be sure to consult with your doctor or pharmacist to determine the best course of action. This medication is administered in a medical setting by healthcare professionals. It is not intended for storage or use at home. Oxaliplatin Vial is used to treat colon or rectal cancer that has spread to other parts of the body. It is typically given once every 2 weeks, and the dosage is based on your medical condition, body size, and response to treatment. The best time to take this medication will be determined by your healthcare provider. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.